Experiences with infertility can be complex and stressful. For couples who want to have a baby, dealing with infertility can be difficult. Infertility affects about 20% of the total male population and is defined by the inability to achieve pregnancy within 12 months of trying. To discuss everything about infertility in men, we have with us Dr. Pramod Krishnappa. Welcome, Doctor. Starting with the first question, we hear a lot about male infertility. How common is it?
Yeah, so the infertility means a couple who are unable to conceive after 1 year of unprotected sexual intercourse. So 1 out of 7 couples go through this infertility issue.
Right. How do one know that he is infertile? What are the common symptoms of male infertility?
Yeah, so majority of them do not have any symptoms till they get married and they're having difficulty in conceiving. Majority of them get diagnosed at this stage, that is after marriage, and they come to us, then some of these things are diagnosed. In very few subset of patients where the infertility, where the cause could be due to an endocrine problem, that is a hormonal problem. For example, a condition like an hypogonadotropic hypogonadism. I know the term is complex. So basically in these patients, the testosterone hormone levels are less, due to which they will have a very small testis, or they may have gynecomastia, which is excess fat deposition around the male nipples, and also easy fatigability and central obesity. So these are some of the features, somebody who have hormonal issues. And of course, if somebody has a genetic issues, it runs in the family.
Right. So these days, we all know how stressful our lives are. So can stress also lead to infertility in men?
Yeah, stress can cause a lot of issues. Definitely, it can lead to infertility. One of the studies from Auckland, United States, what they noticed that in their study, the men who had 2 significant stressful events in the past year, those men had a significantly abnormal sperms in the semen analysis. So what I'm trying to say here is not every stress can affect fertility. Traveling from home to work and vice versa itself is a stress, and all of us have some amount of stress at the workplace also, but not all these stress may contribute to infertility. Some really significant stressful events like loss of a person, loss of a loved one, and significant marital discord, such things will be a significant stressful event, and yes, such things can lead to the infertility.
Right. Since you mentioned that obesity can be one of the cause of infertility, what are the other health complications that can lead to infertility in men?
Yeah, so there are different causes for the infertility. There's a big list of conditions that can cause. To tell in few, as a broadly to tell in simple words, it can be broadly classified into 3 things. One is low sperm production. The cause can be due to so many things, genetics, so on. One is the low sperm production. Second is defective sperm production. That is, sperms are produced in good numbers, but they are not good in quality. So the third is obstruction. That is, any blockage in the channel that carries the sperm. So these are the 3 causes broadly that can be the causes for infertility. This defective production, low production, and obstruction.
Right. When it comes to sperm count, what is the normal range?
Yeah, so this is a $1 million question, to be frank. We have seen couples, especially the men with a totally normal semen report and females with a totally normal fertility workup, unable to conceive. So this has been known, and all these, they come under idiopathic infertility, which means there is no specific cause that can be identified. Since you have asked for a specific normal range, the WHO in 2010 released its 5th edition on regards to the semen analysis, where it said that 15 million 15 million per ml could be a normal range.
When it comes to other reasons, can drinking alcohol or tobacco and marijuana use affect the semen count in men?
Yes, all these do have an effect. Of all these three, the smoking and marijuana have a significant effect. Occasional social drinking will not have much of an effect, but yes, smoking, for example, somebody who does in a recently published study where they noticed that somebody who smoked more than 10 cigarettes per day had a significantly abnormal sperm counts. So yes, smoking does affect the fertility.
Right. There are various supplements that are available in the market to boost sexual abilities in men. Can they have a long-term effect on males' fertility as well?
Yeah, most of these sexual boosters that are available, they mostly contain the testosterone, and all these are exogenous testosterone, which means these testosterone are taken the outside. From outside, they enter they enter the body through the food. So these are exogenous testosterone, which cause a significant feedback inhibition mechanism and thereby suppressing the sperm production as well. And Pfizer did one of the study wherein they noticed that 77% of the uh, Viagra that was sold online was fake. So my suggestion is to please refrain from ordering these sexual boosters online. Most of them are fake and they affect your fertility because the exogenous testosterone that you're taking it can cause negative feedback inhibition.
Right. Are there any genetic or aging issues that hurt male fertility, or does family history also affect?
Yeah, genetics has a role in infertility. Not all genetic mutations can be picked up on tests as of now. The three genetic tests that we do in the evaluation of male infertility in selected patients whom we are suspecting genetic causes. So the three tests we do are, one is the karyotyping test. Again, all these are blood tests. The karyotype test basically helps us to diagnose a condition called Klinefelter syndrome. The second test we do sometimes is a CFTR gene mutation, where when we do this test, when one of the sperm carrying channels, that is the vas deferens, is absent. And the third is we do sometimes a Y chromosome deletion in some men who have no sperms at all in the semen. So these are the genetic tests that we do. And yes, and regards to aging, the traditional teaching to us was that men can father a child all his life, but I feel that this is taking a backseat because we have seen that there has been significant decrease in the sperm counts with age. One of the review papers published 3 to 4 years back, where they assessed the sperm counts from various sperm counts of men from various continents, what they noticed is that there has been a decline in the sperm counts by up to 52% in the last 30 years. So this is definitely a significant number, and with all the radiation around us and with age, the sperm counts do reduce in numbers and also in quality.
So can exposure to pollution also lead to infertility? Because infertility issues are rising on a daily basis, like compared to the last year, this year the infertility cases are more. So is it because of any environmental issues as well?
Yes, the environmental issues usually will not cause infertility in just 1 or 2 years. If you are getting exposed to this pollutants over a long term, maybe 4 or 5 years or over a period of 10 years, then yes, these substances can cause infertility. And also an interesting study published from the University of Miami, where they noticed that even these COVID particles were seen in the testis and penis also. So we do not know what is there in the future, but yes, with the increasing pollution, all these some of these act as a carcinogen, and also some of these affect the sperm counts as well, which may lead to infertility.
Fair enough. Coming to the very important question, can infertility be cured? If so, then what are the available options, treatment options in India right now?
Yeah, so when you're asking about something curable, in male infertility, if the infertility is due to the obstruction, then we can do a surgical repair of that obstruction and we can give a cure for that person. But if the infertility is due to an endocrine problem where the production of testosterone itself is less due to some abnormality in the hormones in the brain, in which case some of these men require a lifelong hormonal treatment. In those cases, I wouldn't say cure, but yes, there is a solution for this, wherein they need to take some medications for them to continue.
Besides,
And when it comes to the advancement in India, definitely there is a lot of advancement when it comes to assisted reproductive technology in India. In men who do not have sperms in the semen, they may have sperms in the testis. So in that case, we may take the sperms from the testis surgically, and then that will be fertilized with the egg in the IVF lab. And once the embryo grows, that can be transferred to the female. So all these advancements are there and they are only increasing in India.
right. I missed one of the one another very important question is circumcision also leads. Can it lead to infertility later in the age if that is being done? When the child is in his 20s.
No, circumcision and infertility is not related. There could be few specific situations like when somebody has a very tight skin, the man may have difficulty in depositing the sperms inside the vagina. So intercourse issues may happen, which can, yes, indirectly can cause a fertility issue. But I would say the phimosis for which we do the circumcision, the phimosis as such will not cause infertility issue.
Okay. So coming to the last question, beside medical treatment, what are the other options available? Like a diet that they should be following or exercise to boost fertility in men.
Yeah. So diet, fertility and diet, yes. A diet which has low amounts of unhealthy fats, less sugar and less salt intake, and to include vegetables and fruits can help improve the fertility. Of course, the most important thing is physical exercise, not to lead a sedentary lifestyle, and also to quit smoking, and also to reduce the alcohol intake to the extent possible.
Right. Thank you so much for giving us your time, for sharing all the valuable insights with our viewers. I'm sure this will help them understand, what infertility is, because many of them shy away from these questions thinking that this can be really awkward. But no, it's very important for them to understand that for men, these are also very important to make sure they're living a very healthy life. Thank you so much, Doctor.
Yeah, thank you. Thank you very much.